No, I'm really sorry that we made you feel this way, because he should trust you, and you can't emphasize on the lack of trust here, because this is really the extremely bad point. If the patient lost his trust in doctors, he will never come back again. So this is something we have to stop on it and not validate it. In fact, to disprove it, but in a nice way. So like, I'm really sorry we made you feel this way. And please believe me, we didn't mean this to happen, and we feeling the same way as you feel. We're really upset about what happened, and this is something should have never happened, and we will do our best to make sure it's not going to happen in the future again. So try to, if he lost his trust, you have to bring it back to him, but don't validate it. You're rushing, you seem to be distressed, like I felt like you are the patient, like you frustrated as well, and you just share the patient frustration. That's all what's happened in the station, but you have to make him trust you back. You have, yes, you acknowledge his anger, like any medical aero station or any angry patient. We acknowledge their anger by saying, yes, I can see that you're really upset with this. We are really sorry about it, and I'm really, if you didn't do mistake, like some station, we didn't do any medical error, but the patient is angry. So we really sorry you feel this way. We are not sorry for what happened because we didn't do any mistake, but we're really sorry about you feeling this way. So just, I'm sorry about your feeling, and I wish I could do anything to make you feel better. So the steps in dealing with angry patients, the first step is to, before you get bad news like this medical error, you have to build a rapport. You have to show some sympathy and empathy to his symptoms, to his procedure, what happened. So you rushed today, like you didn't show me any, last time you showed lots of IBS, if you remember. So this time you didn't acknowledge my feeling, my symptoms, what happened. And the way you asking me was rushing, and you was asking me questions that I felt really doesn't fit, like it's not natural. It's something like maybe coming from script, I don't know, but the consultation didn't feel natural. So I told you, be yourself, like you ask the patient, what are you doing now? And you meant like, is it the right time to talk or not? So it felt like you interfering in my personal life. What I'm doing is not your job. So even you make me irritated before you telling me about the renal biopsy. So just hello, I'm Dr. Kabir calling from this department. Is it the right time to talk? This is the first question to ask. Is it the right time to talk or not? And so you ask him anything you would like to tell me, also anything you would like to tell me. So even I didn't understand, is this question like it came from nowhere, like so I think always just try to not focusing, please try, all of you try to don't read the script in terms of reading the language in the script. It's really disaster. It makes everyone fail. So don't use the language of the script, because it's really like, even if you like, when you know the station, like you know the station, you read the script, even if you didn't use the exactly same sentence, but you influence with it. So it makes you really off topic. You are not listening to me. You are not showing any sympathy and empathy to me. And you're asking me some questions that makes no sense to me, like anything you would like to tell me. So why are you asking me these questions? And in the middle of the consultation, and you didn't break the news for me. And like just, for example, when you started talking to him, may I know why did you do the biopsy? What reason made you to do the biopsy? But if you remember, I told you, you're a doctor, you're supposed to know, because this patient came to you have his medical note, everything written, what symptoms he had. So you can ask in a different way, ask him, since you left us, have you developed, or even if you want to ask about these symptoms made him do the biopsy, ask him in this way. So I have your clinical notes here with me, but if you don't mind, let's have a quick recap about the events that led to the biopsy, about the events that made you do this renal tissue biopsy. So did you develop, what kind of symptoms did you develop? He will tell you and say, I'm really sorry. I'm really sorry about it. Like he will have hematuria or at least one symptoms, urinary symptoms. They wouldn't do renal biopsy for nothing. So he must have hematuria most likely. So and this could be very frightening to see some blood in the urine. How are you now? Do you have any urine blood in your urine currently? Do you have any symptoms at the moment? And if he said if he said yes, acknowledge that. For example, he said, I don't have any symptoms. I'm really glad to feel that you are fine. So try to build this rapport before you start talking about this. So let the patient know that you are here for them and you really care about them before you start telling about the last renal biopsy, because it will ruin everything. And as I told, all BLAB2 station, even if it's counseling, whatever, you will have some marks in data collections, and it has to be organized. So as I thought, always ask past medical history as well. So we will ask about the current situation. Like, we know this patient came with renal biopsy, so this is our situation. What made them do the biopsy, and acknowledge that and everything. Do you have any other symptoms at all? So this is our history of present illness, but it's very fast one because we don't want to make any diagnosis here. So it's quick one because we need more time to the station itself. But still we have to collect data because obviously we need some marks here. Quick past medical history, like apart from this renal kidney problem, have you been diagnosed with any medical condition, any kidney disease in the family? Are you taking any medications, any allergy? Quick questions, taking few seconds. We don't stop, we don't elaborate as much because even he will tell you no. So it's just about having our instruction. So it's finished quickly. It will take around 2 minutes maximum. We will go to the news. So at this point, we already built enough rapport with this patient. You laughed with him, you made him happy, you made him that you really care about him, you showed him good listening, you listening to what he has, and you acknowledge that, and you're ready to help him. Even when you break the bad news, he will still be angry, but he will be less angry because you started good with him. So he will start to be very angry initially when you tell medical error for any patient, or even some stations, the patient came angry in the beginning of the station. So they know the mistake, just they want to talk to you to discuss the issue. Like they're angry about some, like for example, post-surgery infection. So they came to discuss this and they're angry about this situation. The first step is to acknowledge their anger. And the way we have to acknowledge it, it has to be very careful. We don't validate something wrong. Like for example, in the post-operative infection, it happened at home. I had this situation on my exam. The situation, the infection happened at home, and the patient believes it happened in the hospital. So what we need to do is just to share, to say sorry, to acknowledge, like, I can see that you really angry about this issue, for example, and I'm really sorry you feel this way. I'm just sorry about your feeling, but I'm not sorry I did a mistake on you up to now, because I don't know if there is a mistake done or not. We can say sorry when we have a mistake. For this station specifically, yes, we will keep saying sorry throughout. Yeah, we will tell them sorry, because this is our mistake in this station. But still, you have to don't make it that much to validate his concern to the point that makes him more angry, because the patient, obviously, he angry, we want to relax him. So just if you tell them that I can see that you are angry, it doesn't mean you validate it, but it means that you remind them that you are angry and it's time to not be angry. So I can see that you are so frustrated about it. I'm really sorry. I can see that you are so angry about it. So when you say this, they will calm down, because just you told them you're really angry and you shouldn't be, in a nice way. So acknowledging the anger, and the next step, before talking too much, just try to fix the problem. Like, they're angry, we acknowledge it, sort it out, this anger or this frustration. So how we sort it out? By offering solution, like, just, may I know what can I do for you to make you feel better? Like, I can see that you are angry. I'm really sorry for this anger. May I know what can I do for you to make you feel better? Okay, so it has to be the start in these medical error stations. Acknowledging, building a rapport and collecting some data before breaking the news. After that, acknowledging the anger. Yeah, like breaking the error. They will be angry straight away after this error. We will acknowledge this anger, and we say sorry for the feeling, not sorry for the mistake. Sorry for your feeling. And like, I acknowledge it, I know it now, I need to help you with it, with this anger, with this frustration, not with the situation. May I know what can I do for you to make you feel better? So when you ask them these questions, they will tell you, for example, doctor, I need to complain. So straight away, yes, it is your right to complain. I will guide you to the complaint procedure. We have some organization called PALS. Just, you don't need to say the long words, because even will take time. So we have some organization called PALS. I will I will guide you through this. You don't need to worry about it. Is there anything else I can do for you? Is there anything else makes you angry, feel angry? So he will tell you, for example, how can I make sure this is not going to happen again? So tell him, actually, we have a system in the hospital that makes, I think I shared you my handwriting about the sentence you will say in medical error. So we have a system in the hospitals which we will do write incident report form, and this form is going to be discussed in our meeting to make sure this mistake is not going to happen anymore. So this is what we do. So the patient will be relaxed. The mistake is not going to be happen, and it's not just for you, for everyone else. So to make sure this problem is not going to happen. And after they calm down and you talk about, yeah, just you make them happy, whatever they want to complain, incident report form, you explain everything to them. After that, management plan, as Dr. Raymond said, so take things forward. Like, this will be the last step, but we never mention it before the anger completely resolved. Because if you didn't make them happy and you sort it out, what exactly making them anger, which is the mistake, and they want to complain, and you talk about everything, pulse and complaint procedure and everything, senior as well. So after you finish this, he will calm down, he will listen to you, and then this is the time to discuss about this renal biopsy. Because if you brought it early on, before he settled down from his anger, it will make him more angry, and this is what happened in the exam. He will be angry throughout the station, because you didn't make me feel good, and you're just telling me about doing it again. How come? Like, I'm so angry about you, I don't trust you, and you did very big mistakes. I will never come to hospital in my life, and you just asking me simply to come and do the renal biopsy again, and it's painful and it's stressing procedure. So try to sort out the anger first, and then we'll try to convince him by doing the renal biopsy again. So when you tell him, is it okay, for example, to come and do it, so before you tell doing, do you know why, what's the benefit you will gain from doing this procedure? So let him think about doing the procedure is good for him. So do you know what benefit you can gain from doing this renal biopsy again? So he will tell you, for example, he will know already. So he will tell you, for example, to find out what causing my urine problem, so I can get the right medication. So now he knows this renal biopsy is important, and you made him to say this for you, and then ask him, is it okay to do it again? He will get angry again, why, how should I do it, how can I trust you? So makes him, I will make all the necessary, for example, precaution to make sure this is not will happen. I will be here in person for you to send it to the lab and make sure it's not going to get lost, if that's okay. So okay, if he said okay, and it's not necessarily to make them happy, like they may be angry throughout until the end of the exam and still you can pass, but the approach, it has to be right. So if he continued to be angry, it doesn't mean you're doing it wrong, because this is just a station about angry patient, but the approach, it has to be right. Yeah. And the sentence you're saying, forget about the sentence, because it sounds very unnatural to what I'm saying. Try to just speak in your own language. I know when you do it in your own way, it will come much better. So do your own sentences which came spontaneously to what I'm saying. Like whatever I'm saying, like for example, I don't trust you anymore. Say, I'm really sorry we made you feel this way, but this is something we don't want to happen to you, to lose the trust between you and us. And if there is anything we can do to make you trust us back, and please, for example, believe me, this wasn't intentional at all. It just a mistake. It has never happened before, and it should have never, but it happened unfortunately for you, and we will make sure will not happen again. So always try to think, this is your real patient in the real situation, how I can make them trust me, how I can relieve their anger, how I can take things forward. Yeah.